Okay, let's dive into this. Welcome to today's Explainer. Today we're looking at a pretty profound shift in how we actually view healthcare. We're moving away from looking at medicine purely as this cold clinical transaction, right? And we're shifting our entire perspective toward a truly human-centered approach. It's really about looking at the bigger picture of healing and understanding that the best medicine involves a whole lot more than just a doctor and a diagnosis. So, here's our roadmap for the Explainer today. We'll start with the current medical challenge, then look at the limitations of the biomedical model, dive into the biopsychosocial model, explore the therapeutic triangle, cover the keys to the relationship, and finally, wrap up with the benefits for everyone. Let's get to it. Section 1. The current medical challenge. Now, before we can talk about the ideal way medicine should work, we have to face the harsh reality of the modern doctor's office. And honestly, the current context is just relentless. Time is incredibly scarce. Bureaucratic work and paperwork, they're piling up every single day. There are these intense top-down pressures to constantly slash costs, and medical resources are routinely rationed. Consultation times vary wildly depending on the specialty, the local culture, how the care is actually being paid for. It is a high-pressure, totally overwhelming environment for literally any healthcare professional just trying to do their best. But here is the critical catch. While doctors are dealing with these extreme time constraints and intense cost-cutting measures, the patients themselves are actually more complex than ever before. We aren't just dealing with simple one-off ailments anymore, you know? We're talking about layered, chronic conditions that require highly nuanced care and a deep, deep understanding of a patient's medical history over a long period of time. You simply can't solve every problem in a single 10-minute visit. A doctor has to establish priorities and manage that care over the long haul. Which brings us to Section 2. Limitations of the biomedical model. So why is the traditional way of practicing medicine struggling so hard to keep up with these modern complexities? Well, think about it. The traditional biomedical model is laser-focused on a few specific things. It desperately seeks a certain diagnosis, usually at the organic or system level, and it prioritizes a fast, clinically effective treatment. Now, don't get me wrong, that is absolutely excellent for acute issues, like, say, setting a broken arm or treating a sudden infection. But it falls completely short in other areas. It places way less focus on producing actual behavioral changes in the patient and their family. It really doesn't emphasize modifying those deeply ingrained habits, like quitting smoking or losing weight. But as we all know, chronic diseases absolutely require these long-term lifestyle changes to generate real health. Now, what's really interesting about the slide is when we contrast the old paradigm directly with the new one, the differences are just stark. On one side, you've got the traditional biomedical model, which is hyper-focused on the disease and the organic systems. It kind of treats the human body almost like a machine with a broken part that just needs fixing. But on the other side, we have the biopsychosocial model. This approach zooms way, way out. It focuses on the patient as a whole human being, taking into account their unique personality and their specific environment. It's a total necessary shift in perspective. Moving right along to Section 3, the biopsychosocial model. This human connection, this is what's so desperately needed in modern healing today. It serves as a bridge, really, closing the gap between that cold, clinical reality of rationed resources we just talked about and the actual emotional experience of being a patient. Because medicine isn't just about quickly prescribing pills and rushing off to the next room. It's about walking alongside someone during their most vulnerable moments, offering real comfort, and seeking true satisfaction for both the patient and their loved ones. And this brings us directly to Engel's biopsychosocial model. Instead of just looking at the biology of a disease, this approach deeply evaluates the patient's personality. It actively integrates their family, their culture, and their whole social context into the picture. It demands that doctors provide really clear information so patients can actually discern their options. It recognizes patient autonomy, and, this is crucial, it stimulates the expression of feelings, desires, and needs. It's really about explaining the disease process clearly so the patient truly understands what's going on and gets fully involved in their own healing journey. All right, Section 4, the therapeutic triangle. And this brilliantly illustrates how we actually put this holistic model into practice. Notice the P right there in the center. That stands for the problem. But look at what surrounds it: the doctor, the patient, and the family. Instead of just a standard two-way street between doctor and patient, we now have this dynamic triangle. All 3 points are viewing the central problem from their unique perspectives, but they're working together. It completely changes the dynamic of care, shifting it from a one-way monologue to a true collaborative team effort. So here's what that academic concept actually looks like in a real, everyday hospital setting. You see the medical professional, the patient, and the family all engaged together in the room. The practical goal here is to secure the family's support. And why is that so important? Well, because you need them to help manage the care at home, things like adhering to a new diet regime or a really strict medication schedule. When you incorporate the patient and their family into the treatment plan right from day one, you actually secure true adherence to the treatment. It's a total game changer. Next up, Section 5, Keys to the Relationship. Let's move to and see how this builds in practice. How do we actively build this dynamic bond? Well, when a family actively participates, they literally transform the entire medical process. They act as historians, improving data collection. By remembering symptoms or bits of medical history the patient might just forget in the moment, which, by the way, instantly increases patient safety. This naturally improves overall communication, ensuring everyone is on the same page with the treatment plan, which leads to strict adherence at home. Ultimately, sharing this burden improves the patient's quality of life and establishes a much deeper, trusting bond between the doctor, the patient, and their loved ones. It's a win-win-win. But let's be real, a three-way relationship like this requires careful, professional management. The key ingredients to make this therapeutic triangle actually work smoothly include ongoing education, highly effective communication, and a really solid foundation of empathy and trust. It's entirely built on collaboration. But while including the family is undeniably vital, collaboration also requires establishing firm boundaries and respecting privacy. Setting clear limits ensures that the patient's autonomy is always protected, taking into account the unique and sometimes messy dynamics of their specific family. Finally, let's look at Section 6, Benefits for Everyone. So the crucial point is, making this paradigm shift isn't just a nice, warm, fuzzy idea. It produces real, tangible results. We see significantly better communication across the board. We see far greater satisfaction for both the patient and their family members. Crucially, sharing this burden leads to a massive reduction in anxiety and stress for everyone involved. I mean, think about how stressful hospitals can be. And ultimately, all of this combined leads to exactly what we want: much, much better health outcomes. Which leaves us with a critical, somewhat provocative thought to ponder today. Whether you are a healthcare professional getting ready to step into your next shift, or a patient scheduling an upcoming appointment, how do you visualize your next medical encounter? Are you going to accept being treated merely as an isolated clinical case, just ticking the boxes of the old biomedical model? Or will you expect and actively help create an environment supported by the therapeutic triangle, where you, your family, and your doctor face the problem together? Thank you so much for joining me on this explainer. I really hope this empowers you to seek out and build those vital human connections in healthcare. Keep learning, and I'll see you next time.